Good evening. My name is April Demito. I'm a nurse practitioner and I work in the Advocate Clinics in Walgreens Park Ridge location. I am in the process of obtaining my Doctor of Nursing Practice degree from Chamberlain University. The topic of my DNP project is antibiotic stewardship, and many of you helped me by completing the antibiotic knowledge survey that I distributed a few weeks ago. The next piece of the project includes the distribution of an antibiotic stewardship toolkit for you to use in the clinic that will help you um, work with the education of patients in the clinic regarding the need for antibiotic use. I hope to distribute many of these toolkits personally. However, I realize that going out to all 56 locations may not be possible. So I elected to make this short video so that you would understand the process of the toolkit and how to use it. And the locations I'm unable to get to personally, I'm going to mail the toolkits directly to the clinics. So let's see what the toolkits contain. This is what the binder will look like. The clinic locations that have 2 nurse practitioners will have 2 binders. The first piece of the toolkit includes a commitment to our patients. This commitment letter is a legal size cardstock letter, and I'm asking that clinicians in the clinic read this, and if you commit to the stewardship process, to sign this and then hang it on the wall in the vision of the patient. So of an area where the patient will be able to visualize it. I'm enclosing little stickers for you to utilize to place this on the wall. So that's the first piece. Inside the binder, you're going to find a few of these trifolds. I've tried to um, put at least 8 to 10 in each binder, and you certainly can make copies of these if you like. Everything is an open access document provided by the Centers for Disease Control, so there is no copyright on any of the materials in the binder. This is a teaching tool to use with patients. Many patients don't understand the differences between viruses and bacteria. So the use of a visual aid may guide patients in the process. This is a chart that explains to patients what the color of their mucus is all about. I'm sure you all, as I, have patients that come in and think that because their mucus is green that they need an antibiotic. And that's not the case. Green indicates that their immune system is really fighting. So again, a tool for you to utilize in the clinic so that the patient can visually see what the color of their mucus means. This particular handout focuses on children and those runny noses and coughs that they get that last for weeks. This gives the parent a guide that yes, these are the symptoms that your child has. This is what you can do for it. And no, antibiotics are not going to make the symptoms go away. We know that these viral infections can last weeks. And it also explains why we don't want to use antibiotics, that antibiotics can cause resistance and it can cause side effects like rashes, dizziness, and stomach problems. I've included a handout on bronchitis, and bronchitis or upper respiratory infection is actually the condition that is most often prescribed an antibiotic. And the research supports that actually 95% of all bronchitis is viral in nature, and antibiotics are not indicated. This can visually show the patient why this is the case, why antibiotics are not going to help, that this is an inflammatory process. These are what the symptoms are. And it also clarifies, yes, you need to seek medical care if you are experiencing these symptoms. The picture also displays the difference between a normal and a abnormal bronchus, and what exactly the pathophysiologic process of bronchitis is, with that increase in thick sticky mucus and that inflammation that's causing the symptoms. This illustration speaks to ear infections. We see so many of those in children, and it explains to the parent the difference between an otitis externa and an effusion and an otitis media. Also, things that we can do to help prevent those things from happening. And penicillin allergy. Actually, only 10% of patients who present with a penicillin allergy are actually allergic to penicillin. And in the fight against antibiotic resistance, the use of penicillin has become a very important factor. So I'm personally advising my patients, if they've not been skin tested and challenge dosed, that they should seek out guidance from an allergist to see if they are indeed allergic to penicillin. Now, I have a few handouts in here that you can utilize with your patients that I think may be helpful also. And these have multiple pages and can be copied as well. This one explains to the patient some of the symptom relief for viral infections. So you can give them some tips, and it's a simple check-off box so that they can leave feeling as though they have a treatment plan in place. This particular handout is a note to give to daycare centers and preschools. Uh, Often, preschools send children home because they may have a cough or a runny nose, but actually there isn't any reason that these children cannot participate in school activities unless they have a fever or they're just plain miserable. So this is a handout that you can fill out and give to the parent to give to the school to let them know that it is okay for them to attend classes. This final document that I have in your binder is on delayed prescribing. And uh, this is primarily for those patients that are right on the cusp of potentially needing an antibiotic. And it provides a treatment plan for them to hopefully get through those next few days and begin getting better so that they do not need an antibiotic after all. So delayed prescribing is another initiative to try and reduce the amount of unnecessary antibiotic use in the clinics. I hope that you'll find these resources helpful, and I also want you to know that I do have approval from Advocate Medical Group to do this project. However, I need to make the disclaimer that this is my individual Doctor of Nursing Practice project and is not associated with Advocate Medical Group. And thank you so much for your time.